Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Good morning, I'm Dr. Kerry Gelb, and welcome to Wellness 1280 on Open Your Eyes Radio. Please listen as I discuss the newest information in the world of health, nutrition, and sports every Saturday morning, 6 a.m. Central Time on 1280 The Patriot. Also, please share your thoughts by emailing me at drkerrygelb@gmail.com. That's drkerrygelb@gmail.com, and visit my new website, wellness1280.com, where we have all guest links, Wellness 1280 info, and previous shows. Wellness is taking over the Patriot Airways for the next hour. Sit back and enjoy my conversation with Dr. Tim Guilford. Glutathione is considered the mother of all antioxidants. Glutathione is essential to fight illness and prevent premature aging. Functions of glutathione include helping the immune system, fighting inflammation, and detoxification. Today's guest, Dr. Tim Guilford, MD, PhD, that's MD, PhD, has dedicated his life to researching glutathione. Dr. Guilford is a board-certified ENT, head and neck surgeon, and then he transitioned to complementary medicine. His company, ReadiSorb, which formulates liposome glutathione, has helped thousands and thousands of people. Dr. Guilford, thank you for joining me today on Wellness 1280 on Open Your Eyes Radio with Dr. Kerry Gelb.
Good morning, Dr. Gelb.
Dr. Guilford, I want to tell a story before we get into what is glutathione. I've been using your product for many years. I met you about 10 years ago at one of the integrative medicine conferences, and where I first learned about your product. And I have Parkinson's in my family. My grandfather, my father's father, had very severe Parkinson's, and he eventually died of it at 96, had a nice long life, but suffered with it for the last 5 to 7 years of his life. My father's, that's my father's father, as I said. My father's sister has Parkinson's and has a tremor, and my father was starting to get a tremor. And because I knew about your product, and I saw Dr. Perlmutter's video, you probably know about that online, where he did IV glutathione, and there was a temporary effect in some Parkinson's patients. I started using your glutathione from your ReadiSorb Glutathione on my father, and I can tell you he's going to be 91 July 20th, and he no longer has a tremor, and he's doing wonderful. So I want to thank you personally for that, for helping my father.
Well, you're quite welcome, and I appreciate hearing that story. Over the years, I've seen many people improve with tremor taking ReadiSorb Glutathione. Early on, we had a study with a researcher interested in developing or using the ReadiSorb in those patients. And Dr. Gail Zivak back at New Jersey Medical Dental looked and saw that our product went into cells much more readily than plain glutathione, because the regular form of glutathione in the system has to be reconstructed inside the cell, and the liposome form can go directly into the cells and benefit their antioxidant system and detoxification, and that plays a big role.
And I mentioned that glutathione is the most important antioxidant or the mother of all antioxidants in the body. Tell us first, what is an antioxidant and why is it important to deal with antioxidants in our body?
Various systems inside the cell will produce what's called free radicals. And these radicals are a chemical term for a structure that has available electrons, which means it'll pull stuff away from other chemicals, normal chemicals, and even the membrane form inside cells, and creates havoc inside the cell. And so the body has developed antioxidants to fend this off. And one of the most important ones, perhaps the most important one, is glutathione. Glutathione is relatively simple, and it allows the release of or the absorption of these free radicals and their removal. And so it's used inside the cell. I saw one estimate that each cell has 150,000 free radical hits every day. So you can imagine the enormous number of these reactions going on in the body all the time. So glutathione needs to be formed in every cell all the time. That's what basically is happening.
So what happens if there's more free radicals than antioxidants to combat the free radicals?
Well, cells can be damaged, and what starts out is that the enzymes working inside cells quit functioning as well as they should, and soon that compromises the ability of the cell to survive, and you'll get compromise of function inside various organs. And in the case of your father, that type of thing becomes manifest in some of the brain cells. And so there's less coordination of movement and things like that with Parkinson's disease. And so maintaining an adequate glutathione supply throughout the body is important. And this is something your body will do, and it will take natural foods and reconstruct glutathione until certain things happen in the body. For example, the enzymes needed to form glutathione are diminished in people as diabetes worsens. As the glucose level goes up, these enzymes quit being formed. And so people are susceptible to problems ranging from infection to accumulation of toxins. And I think many of the complications of diabetes are related to deficient glutathione.
Now,
Go ahead.
Glutathione is a tripeptide. Could you talk about me? Can you tell us about the amino acids needed to form glutathione?
There's 3 amino acids: glutamine, glycine, and cysteine. And cysteine is in the middle, and that's the one that has an available sulfur molecule to interact with these free radicals and dampen their function. And so when you get a oxidized glutathione, it will bind to another glutathione and form a double bond there that has to be reconstructed into normal and active form. So there's actually some enzymes that help keep glutathione in an active form. And most of the time they're functioning well, but occasionally people will have problem with that area. There's many little areas that will prevent the correct production and function of glutathione.
So the body has to keep making glutathione. And what foods have cysteine, what foods have glycine, and what foods have glutamine to be able to form glutathione in the body? These are amino acids that are essential that the body doesn't make. We have to eat them, but then the body will make the glutathione. So what foods?
You get these from your normal vegetables and fruits and that sort of thing. One of the key ones are the cruciferous vegetables, broccoli and things like that, which will stimulate the formation of glutathione due to their chemical interactions. But you're going to need to eat a very normal, varied diet. Will provide plenty of these amino acids. A specific food that carries a lot of glutathione is like avocado. But you unfortunately need to eat such a large amount of avocado to get the glutathione that eating avocado alone is not going to solve the problem. Where these problems occur, for example, we saw recently with the COVID infection, I wrote 3 articles during COVID, which described the impact of loss of glutathione in allowing the virus to replicate. And in those articles, we talked about the fact that the body needs to, or viruses need to deplete glutathione in order to facilitate their replication. And conversely, maintaining your glutathione during an illness like that will help fight the virus replication.
And we have about 45 seconds left, but for viruses in general, a common cold, is this glutathione helpful?
It is, in my experience, very helpful.
So we were talking about what glutathione is and about being the master antioxidant. Let's talk about some of the functions that glutathione has in the body.
Well, glutathione is an antioxidant. It also facilitates detoxification, and it's a key ingredient or key component of controlling the immune system. Some of the immune hormones we call cytokines become elevated, and some of these elevations result in people feeling poorly, like with viruses. And it had been my observation for some time that people will benefit from taking an increased amount of glutathione during a viral infection. What happens is the viruses shut off the normal production of glutathione, and so glutathione becomes an essential element that some people will be able to respond to quickly, but people with illnesses like diabetes will not be able to manufacture the glutathione as quickly. And we just had a study published this year in which young animals depleted a bit of glutathione were given an exposure to the virus called respiratory syncytial virus. Many people know that as RSV. And RSV will shut off the production of glutathione right in a central area. And so it becomes essential to supply glutathione to limit the progression of that infection, which they demonstrated in mice in a study. And that was very gratifying for me to see. I'd been telling people that that's the way it worked, but to have a nice study supporting that is what you need to have in medicine to convince people.
I wanted to ask you about the immune system, how it aids the immune system, because it helps in the production of T cells and it increases NK cells, the natural killer cells, which is important in fighting cancer. Now, is that what I'm saying correct? And could you elaborate on it?
We've actually had studies done in which it shows that glutathione will support the function of these cells. The key easy thing to remember is many of the listeners may remember studying the macrophage cell in biology. That's the big eater cell. Well, it turns out that that cell needs glutathione to function. And if you get an excess, for example, of toxins or even too much cholesterol, those cells can't pick it up and convert it into the forms that can be returned to the liver. We actually had a study done back in, published in 2010 that shows that if you don't have an adequate supply of glutathione, your cells can't metabolize the cholesterol efficiently. And as I say, most of the time people can make enough glutathione on their own, but if they're having chronic illnesses and or acute illnesses, taking a product like ReadiSorb Glutathione to supply glutathione into the cells may be quite useful.
Now, I'm very interested in sports performance, and glutathione increases nitric oxide, and therefore getting more nutrients and more blood to the muscles of the body, and therefore it increases CO2 max. So can you talk a little bit about that?
Glutathione, when people exercise heavily, they cause some oxidation stress. And there's a system in the cell that when you have what's called oxidation stress, that's too many free radicals, it'll actually turn on the cell to make more antioxidants, including glutathione. And the symphony of enzymes that work with glutathione. Glutathione is the central portion of a symphony of enzymes that facilitate antioxidant function and detoxification. And that's all occurring in people that exercise heavily. And by repeated exercise and training, you're building the ability of this system to function on its own.
So, but when you do exercise, you lose glutathione, isn't that correct?
You will lose it, but your body will then be stimulated to make more. And a normal, healthy individual will be able to, although there have been concerns about people with heavy exercise coming down with respiratory illnesses, for example. And in those cases, those people may not be manufacturing glutathione as adequately. I was just watching the Tour de France this morning on TV, and they were talking about some of the participants coming down with COVID. And the COVID virus blocks the formation of glutathione. And so these athletes are not able to maintain that rigorous continuous exercise. And some of them were not able to participate, and then several dropped out during the race.
Now, if they were given glutathione, after how long do you think it would take before they would be able to get glutathione back in their body and start feeling better?
In my experience with these, depends on the virus, of course, and the severity as well as the overall health of the individual. But I've seen people improve within a few days of starting supplementation with ReadiSorb. But each individual is going to vary that timetable just a little bit depending on their own overall health.
And do you think glutathione would be something that people that are very into sports is something they should consider because of the increase in nitric oxide and the increase in blood supply to the muscles?
That's an interesting question that's been considered. If you give outside glutathione support to people who are training, will that allow their cells in their body to develop its own system? And so I think the way that I would approach it is to work on your training with a good diet and that sort of thing. And then after a heavy exercise, I have a friend who told me about bike ride once a week with his buddies. And afterwards they'd come home and have an energy drink. And one day he slipped in some ReadiSorb glutathione, and his friends said they recuperated a lot quicker. And so I think for training, the general rule of thumb would be to let your own body develop. And then if you have problems like a cold intervening, then an outside supply of glutathione is going to be very helpful in reducing the impact that has on your body.
And how about glutathione for recycling vitamin C and vitamin E?
All these vitamins work together to re-energize each other, but glutathione becomes a critical component in keeping these antioxidant enzymes functioning. And a surprising thing that's come up in the last few years is the awareness that vitamin D plays a role in there also. Vitamin D and glutathione work in a synergistic fashion, each one stimulating the production of the other. And that's where you hear some doctors talking about supporting vitamin D for defense against viruses, for example.
And my understanding is glutathione and vitamin C help with VO2 max. Is that something that you've looked into?
I can't relate to that, but if you have some information, I'll be happy to discuss it further. One thing I know, we have a paper that came out that we published. I was co-author of 3 papers through COVID. And the first one talks about what happens in the silent hypoxia as decreased oxygen availability is called. And in that paper discusses how the cells that maintain the ability for gases to go in and out of the body, such as the release of CO2 and then the intake of O2, you can actually release CO2 more easily. And people with COVID, especially early in that illness, in the pandemic, doctors didn't understand how someone could come into the emergency room and be able to talk, and then you go back and interview them 20 minutes later, and they'd need to be intubated. And that's because these people were able to release CO2, but not get the O2 in. And so they wouldn't have the normal drive for oxygen. They wouldn't feel short of breath and things like that. So that's a very interesting component of how the virus kind of snuck up on people and doctors' awareness of how severe they were. And that's where it became popular to get your concentration of oxygen using those little meters that you put on your finger, for example, to monitor the early stages of COVID. And I think that's still an important thing, and it's a relatively inexpensive piece of equipment that gives you a tremendous amount of information in maintaining your health.
How about glutathione as far as repairing proteins?
Repairing proteins. Well, glutathione is going to support the energetic system in the body. When we make energy in our mitochondria, that's the energy producing organelles. That means small organs inside the cell. That's where a lot of free radicals are formed. And it turns out that glutathione is actually pumped into the mitochondria. Glutathione is made in the outside surrounding cytoplasm, as it's called, of the cell. But then some glutathione is pumped into the mitochondria to maintain antioxidant function. Yes, we have enzymes in there that help protect the mitochondria, but an excess of free radicals are formed that specifically require glutathione peroxidase. And the presence of glutathione to support that enzyme, the enzyme peroxidase actually takes the free radical and brings it into closer proximity to glutathione itself. And glutathione can then hand off the hydrogen and electron to negate that free radical. The classic free radical that causes damage both in mitochondria and around the cell is an OH radical, and the glutathione can hand off an H to create H2O, harmless water.
We're speaking with Dr. Tim Guilford. We're going to be back after the break, and we're going to talk about diseases linked to low glutathione. We'll be right back.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
We're back with Dr. Tim Guilford, his company, ReadiSorb. It's ReadiSorb.com, ReadiSorb.com, when we're talking about glutathione. But he has other products, vitamin B12, which I take, and I also has his melatonin that I spray in my mouth at night. And I have no affiliation financial with Dr. Guilford, but I just love his products. He's helped my dad that we talked about at the beginning. So if you haven't heard the beginning of the show, go back and listen. You could hear that story. I do want to ask you before we move on about the diseases, Dr. Guilford. Glutathione is the master antioxidant in the body, but how about its, I call it its stepbrother and sister, SOD and catalase, superoxide dismutase and catalase. Have you ever thought about formulating that as a help with glutathione, or do you think it's not as important?
Well, I think they're important. That's a good consideration, but glutathione forms a foundation for many enzymes that function in a similar fashion. And both SOD and catalase are enzymes which need to be stabilized, and they may be more difficult to stabilize than the glutathione. They're important right in the mitochondria themselves, the energy producing units, in taking the first radicals that are formed from oxygen metabolism and converting them into forms that are less dangerous. Unfortunately, along the way, SOD, for example, can create this OH radical. And when our ancestors, the mitochondria, were free living, that is, let's say out in a open water environment, they could just excrete that OH radical instead of allowing it to cause damage. The problem is inside the cell, that OH radical has nowhere to go. So over time, the glutathione system was developed, which can release a hydrogen and its electron to combine with the OH radical and create harmless water. And that allows our energy producing units, the mitochondria, to function maximally. And that's what happens when you were talking about training. Training will help increase the glutathione production. In fact, all toxins, ironically, when people start smoking, the glutathione production goes up. and things seem to be fairly stable until that system is compromised for some reason, and then you lead into the health problems associated with excess smoke exposure, for example, and even air pollution. There have been studies that show that children growing up in polluted environments, the ones that have genetic defects in the production of glutathione, will suffer more pulmonary problems. And pulmonary problems if one has problems with the lung, often taking an outside source of glutathione as supplied in ReadiSorb Glutathione can be helpful. And it may work more quickly with an acute problem. With a chronic problem, it may be slower, but it may be helpful overall. Unfortunately, there's not many studies that document that. And I mentioned this study that was just done in mice, showing that lung damage from the virus called RSV can be lessened if they're given ReadiSorb Glutathione at the time of the infection. And that's an important study. They actually focused on the function of the defensive cells inside the lungs called the macrophage, the big eater cell that performs many functions in our body, from cleanup to defense against invading bacteria. And we've actually had studies done in people that have a defect in their ability to form glutathione. That occurs in people with a virus such as HIV and or in people with diabetes who, as the glucose goes up, the enzymes needed to form glutathione quit working as efficiently, and they become inefficient in their defense against infection. And they actually took their cells of the participants in the study out of the body and then infected the cell with a bacteria. In this case, they used tuberculosis. And they found that the people that were low glutathione, that organism would grow readily or rapidly inside the cell, where the participants who took the ReadiSorb Glutathione, growth of the bacteria was significantly diminished. So they had a much better outcome in their cells. They didn't infect the people, they infected their cells outside the body.
So in the last segment, we talked about some of the functions of glutathione. It's an antioxidant, it fights inflammation, and it detoxifies. So I guess any disease that has to do with inflammation, really, glutathione could help. Well, let's talk about some of the main ones that we know about, such as neurodegenerative disease. Like we talked a little bit about Parkinson's or early Parkinson's. How about MS or early dementia?
There's actually a study that was done that shows that elderly people who are otherwise healthy, as their glutathione goes down, their cognitive function decreases. And at the same major university, another study was done showing that if in people that have a history of heart disease, if their glutathione, as it diminishes, their risk of severe heart problems increases. So there's an example of importance in things related from both brain and heart. We talked about lung function. There's a classic study I like to refer to where they took a look at the lung fluid in people with various diseases. And as these chronic lung diseases increased, the level of glutathione went down until you ended up with what's called the acute respiratory distress syndrome, in which people had a very low glutathione. And I think that's an example of situations that may improve significantly taking an outside source of glutathione. So I look at ReadiSorb Glutathione as a medicinal to be used for people that have a predisposition to a problem, as you were talking about with Parkinson's disease, and also with acute diseases. Healthy people who don't have any problem may not need it, but I urge people to have some available so that they, especially in this day and age where we contract viruses all the time, such as COVID. There was a beautiful study done from the NIH that documented that glutathione becomes deficient even during mild and moderate episodes of COVID. And ironically, they showed that those deficiencies persisted for 50 days, almost 2 months after the illness. I keep lobbying for more studies to look at people with after COVID to see how long the glutathione stays down. And I'm trying to get a study together pursuing that right now.
I want
We've
to
been
name
very,
some. I want to name some other conditions. If you could comment that chronic liver disease, autoimmune disease such as rheumatoid arthritis. We talked about diabetes, infertility, low sperm quality, and protection of female egg, and mental health, bipolar
yeah,
depression,
yeah,
inflammation.
that's interesting. All these conditions are related to low glutathione. And it's been difficult to get studies done, I think, in the past because we were using precursors of glutathione. In other words, things that need to be cysteine, for example, that is the basis for glutathione, but it needs to be converted inside the cell into the form of glutathione to be most efficient. And so there've not been many diseases studies shown that it will prevent or cure disease. And that's one reason why I'm so excited about this study I mentioned in the mice exposed to RSV, where their lung damage was significantly lessened. But you're right. And the other thing people don't think about is that alcohol consumption can deplete glutathione. And I have had friends and other people tell me that it's really great for the morning after problems after excess alcohol consumption, for example.
How about non-alcoholic fatty liver? I saw there was a study done, 1,300 milligrams per day for 4 months, and that people did well. Is that a study you could comment on?
There is a study that showed that fatty liver can be improved taking that. I think that was done with plain glutathione. And the one problem is, as you progress, as I mentioned, many people with diabetes, for example, the plain glutathione will quit working as you get to a level of hemoglobin A1C of 6.5% or higher, and the enzymes quit working. And we have a study showing that with ReadiSorb Glutathione, our product goes into the cells and improved immune function in general, and reflected in the immune hormones called cytokines coming back down to normal, and in the ability of those cells to defend against bacterial infection.
And you talked about what lowers glutathione. We talked about alcohol, intense exercise, drinking, smoking, lack of sleep. What else is there how about certain medications? How about medications that lower glutathione, such as NSAIDs or Tylenol, anticonvulsives? Can you mention?
Tylenol's been documented to decrease glutathione production. But of course, the precursor material, N-acetylcysteine, is used in emergency rooms, given intravenously for people that have overdoses related to acetaminophen. That's the generic name for the product you mentioned.
And they use aerosol. They use like air spray, NAC, so it goes right into the lungs. It bypasses digestion. Is that correct?
I am not familiar with aerosolized NAC, but I wouldn't be surprised to hear it. Products like that need to be formed in a pharmaceutical manner so that they're sterile for inhalation. So I don't personally have a lot of experience with aerosolized products. Our product was formulated for, designed to be taken with juice or water and ingested orally.
In some of my research, I found that glutathione is a drug in certain countries. Is that correct?
It is in certain countries. For example, in Japan, it's considered a pharmaceutical, which in this country was introduced as a nutrient material early on. And so that's how glutathione has been available. And we found that if you take the glutathione orally, it gets broken down before it gets into your cells. It will provide the components. But what we did is put the glutathione in the active form into a liposome, which is a little fatty bubble that allows absorption, and then allows penetration of the material directly into the cells. And we have studies documenting that this increases the absorption of glutathione compared to plain glutathione by 100 compared to N-acetylcysteine by 1,000 times. It was quite a startling factor to see that, and that's been documented in 2 different studies. So it has much greater absorption. And
what percentage when you take ReadiSorb liposomal glutathione do you think gets absorbed? Is there a percentage you could say?
I've not seen percentages on that, but there's very high absorption with our product, and we've seen that in practicality, giving it to patients, seeing or to individuals, sometimes seeing benefit within a few minutes time.
And
I
how
mentioned
about powder? How about powder glutathione? Don't you guys have a powder?
we've recently developed a powdered form that has similar absorption and really stabilizes the product. It's a lot easier to ship into hot environments. It stays stable for much more easily. The liquid form has problems when we ship it. We have to make sure it stays cool because it gets clumpy and a little bit of that sulfur aroma from glutathione comes out. I want to mention that we had another study that was published this year related to taking the spike protein from COVID-19 and putting it into a culture of normal cells and showing that you got this big elevation of the immune hormones called cytokines, as well as the release of fibrin that forms this foundation of clot. And so that's the foundation for what's called the immunothrombosis, that is a pathology related to a virus such as COVID. And the ReadiSorb in the cell culture blocked these changes that I just described. So it looks like it could be a prevention for that type of thing, but we don't have clinical documentation. It's really hard to get that in the time where everybody's either been exposed to the virus or has been immunized. But that's very exciting information for me to see, and that's a published article.
So we have regular glutathione, which doesn't have very good bioavailability. We have liposomal, which is a type that you make, which has excellent bioavailability because it bypasses the first pass effect of the body. Then we have powder that's coming out that is also, I guess, liposomal. And tell me about IV. You know, when I first, and I talked about this at the beginning with Dr. Perlmutter, when I first saw his videos giving IV glutathione to Parkinson's patients that were basically totally disabled, and then they could walk and they could, for a very short time. Tell me about that, and how could that relate to your product?
That type of benefit with intravenous infusion of glutathione was partly what stimulated me to consider another absorbable form. It was clear that people benefited from intravenous glutathione, which can be purchased from a compounding pharmacy. Unfortunately, in this country, we don't have pharmaceutical grade glutathione easily available. So I developed the liposome absorption form so that people could take glutathione and get it into their system not only several times a week, instead of having to go in and get an IV, but actually several times a day, which is really what you need when you have an acute infection that blocks the formation of glutathione. You just don't appreciate what glutathione is doing for you until if you get an infection like COVID, then you begin to understand the illness comes from I think, in large part, the depletion of glutathione. And if you can get a source of glutathione from the outside world, that's called exogenous, from outside, to support it, you may limit the duration of those symptoms.
I mean, glutathione is our master antioxidant. The body's making it for a reason. As we get older, it doesn't make it well. But I want to ask you about the precursors. You mentioned that. I'm going to name a few: selenium, N-acetylcysteine, glutamine, as you know, glycine, alpha lipoic acid, omega-3s, vitamin C, B12, having adequate protein, and foods that contain glutathione, and foods that contain, that we talked about at the beginning, cysteine, glycine, and glutamine. So if you could talk about which of those precursors that you think are the best for forming glutathione in the body.
I think you need all of them. I think history of medicine has shown us in research that cysteine is a key component. And as I mentioned, you get this from the foods that you eat on a regular basis. So a varied diet will supply that. There have been studies that show that supporting glycine is also important, and glutamine as well. But each of these come from dietary sources as opposed to having to take them individually. N-acetylcysteine has a history which has shown that it can support the building of glutathione inside the body. And this was actually studied well enough that it became a pharmaceutical level material also. But I think that while cysteine has an excellent function, taking the whole form of glutathione into the system in a liposome, for example, may give more dramatic or quicker results. And as I mentioned, we have a study that showed that they both, but you had to take 1,000 times larger amount of the N-acetylcysteine to get the same effect in the laboratory studies that are published compared to the ReadiSorb Glutathione.
Why, as we live longer, do we make less glutathione?
Why do we make less? That's a good question. I wonder if it's not related to the accumulation of toxins and things like that in the body. I don't know why glutathione becomes less produced as we get older, except that it's part of the general process we call aging. Glutathione alone does not prevent aging, but it's certainly a big component in our preservation of our system to help prevent the accumulation of toxins and things like that. So I think the exposure to toxins is a big component of that. And some of these toxins are difficult to excrete, and that's why some of them show up better or excrete better in people that are undergoing sauna, and will show up in their sweat and things like that. And these same toxins will help diminish glutathione on a chronic basis, but they can't be removed. So that's part of the contribution to aging.
And glutathione works on both phases of detoxification. If you could, we only have about 1:40 left, and quickly, if you could tell us about how it works in both phases.
Well, the phases, it refers to binding the toxins and converting them into natural or neutral components, and then binding and excreting them and carrying them out of the body. And people break that down into different phases. But glutathione will help support each one of those components.
You know, really quick, I mean, I was listening to a doctor who talks about cancer being a metabolic disease, and he was saying that glutamine it feeds cancer. Do you buy into that?
Almost cancers are, when you look at them, they're really quite different. Cancers are able to metabolize almost every component of our nutrition. For a while, there was the idea that you could stop eating one component that cancer uses, but it turns out cancers can shift to different components. And the whole mechanism of cancer is quite fascinating. Oxidation stress begins to change the metabolic functions inside these cells that allow them to survive, and in their struggle to survive, some of them become cancer cells.
We're going to leave it there. This is Dr. Kerry Gill with Dr. Guilford. Dr. Guilford, if people want to find out more about you, how could they do it?
ReadiSorb.com is the simplest way to, we have contact information there, ReadiSorb.com. And that's the easiest way to start.
Well, thank you, Dr. Guilford. This is Dr. Kerry Gill for Open Your Eyes Radio. We'll see you back next week. Thank you, Dr. Guilford.
I appreciate the opportunity to interact with you. Thank you.
Thank you very much.
Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.